I was wondering if I can check the difference between measles, which is rubeola, and between rubella, which is German measles. We can have simply Google search. First of all, we need to find Google itself. Then here we are, difference between measles and German measles. During my search, I found some tables and some pictures which made it easy for me to check these difference simply. Here we are. We can find here the difference between measles and German measles. First of all, measles, the most important part or difference between them is the rash. At measles, rash is bright red rash, spreads from face, then go downwards. But in German measles or rubella, it's light pink rash, not bright red. No, it's light pink rash, spreads from face and downwards. Okay, then other symptoms. In measles, it will be much more severe. We will find high fever, cough, red eye, and complex spots. This is complex spots. We can find it here. Yes, that's it. Okay, complex spots. If we zoom this one, we will find this is a pathognomonic of measles. Small bluish white spots on red base, looking like grains of salts. This is the photo of complex spots. We can find more photos about complex spots like this. These photos are all about complex spots. These photos also. Okay. And this video, it's also here complex spots, very clear, and we can differentiate it from any other mouth ulcers or anything like this. Okay, so if we go back to our photo, severity more severe. Measles is more severe, can cause pneumonia, encephalitis, but German measles, it's mild in children but dangerous in pregnancy, which causes congenital rubella syndrome. Let's have a look at congenital rubella syndrome. Simply, clinical features of congenital rubella syndrome. There is something called classic triad of congenital rubella syndrome, which congenital heart disease, congenital ocular defects, and hearing loss. At the heart, it can cause patent ductus arteriosus, which is PDA, pulmonary artery stenosis, pulmonary valvular stenosis. Okay, all these things can happen in the heart. Then ocular defects like congenital cataracts, microphthalmos, pigmentary retinopathy, and congenital glaucoma. And the third part of the triad, which is hearing loss. Congenital rubella syndrome is usually associated with failure to thrive and developmental delay, as well as microcephaly and other common presentations at birth. Presentations at birth, apart from this triad, we can find Berberich rash, hepatosplenomegaly, meningoencephalitis, radiolucent bone, hepatitis, and thrombocytopenia. Okay, which is very, very dangerous. We can have a look about congenital rubella syndrome. The baby will be like this. Okay, so it's very dangerous. And part of the triad is here, which is eye effects, and this photo also. Okay, if we get back to our table, contagious period for measles, it's 4 days before and after rash. For German measles, 7 days before and after rash. Okay, this photo also we can find here type of virus itself. In measles, it's paramyxovirus. In German measles or rubella, it's rubella virus, toga virus. Okay, which is a toga virus. About the spots or the rash, we can find it that it's pinkish, but here it's reddish. Pink spots starts on face and spreads down. Okay, and fever here is mild, rarely exceed 101 Fahrenheit. At measles, red and blotchy, starts at hairline and spreads down. High fever, often 104 Fahrenheit or higher. Okay, so this was a quick review or a quick look about measles and German measles, and will be the first video in this simple way to study and to revise our information and our knowledge just through Google search. See you again. Bye.